again to the Medical Terminology Podcast. This episode is Chapter 7, Part 2, Respiratory Pathologies. Going to review with you the pathologies that tend to be confusing or give folks trouble, particularly in the areas of the different diseases. It's kind of hard to tell them apart, so I'm going to try to clarify what the distinguishing characteristics between them are. First of all, in the textbook, it presents a general term that represents a variety of diseases that are associated with smoking, and that is chronic, obstructive, pulmonary disease. That's quite a long term. Chronic, CHRONIC, obstructive, OBSTRUCTIVE, pulmonary, PULMONARY, disease, DISEASE. And we often see it abbreviated with all capital letters COPD. And this is a general term for a breathing disorder in which it's difficult to get air in and out of the lungs. And we use this term for diseases that are often associated with smoking. These are diseases you're just not going to get unless you're smoking. The first term is chronic bronchitis, CHRONIC, bronchitis, BRONCHITIS. In this condition, as you might guess from the term, the bronchi are inflamed, there's inflammation, and they're thickened, and there's an abnormal increase in mucus production, causing coughing and difficulty breathing. And this is an inflammation, again, that would be caused by smoking. There's not a disease process going on as in an infection. Often we associate infection and inflammation, but this is one of those cases where there is no infection. It's just the inflammation. And I hope you remember that chronic means it's an ongoing condition that cannot be cured. It can be managed, but it cannot be cured. The person is going to have to live with it. The next term is emphysema, EMPHYSEMA. That's a little tricky to spell. Emphysema is a progressive loss of lung function that's characterized by a decrease in the alveoli and the enlargement of the remaining alveoli, which results in increasing rapid, shallow, and difficult breathing. Now, alveoli is a term I don't believe we covered under the anatomy. Do you remember from looking and studying at the textbook what alveoli are? Well, the alveoli are these little sacs in the far end. The tree keeps dividing and dividing and dividing into bronchioles, and those bronchioles end at the alveoli, and they're these little sacs. And that is where the air exchange actually takes place. So if you're lacking alveoli, you're lacking the ability to exchange air. And the remaining alveoli will enlarge and struggle, and they eventually will die off and decrease as well. And so this makes it very difficult to breathe. So these two terms both fit under the umbrella chronic obstructive pulmonary disease. We've got the chronic bronchitis and we've got the emphysema, which is the loss of the alveoli, and both of them are caused primarily by smoking. The next term we have is asthma, ASTHMA, and most of us have heard of it and familiar with it. Asthma is an allergic disorder characterized by episodes of severe breathing difficulty. In this case, the person who has asthma encounters some trigger, some allergen out there. The body overreacts to that allergen and it sets up an inflammatory response, and that causes the swelling and closing of the bronchial tree. And so that causes severe breathing difficulty. After introducing us to COPD and asthma, the textbook goes on into the next major section, which is upper respiratory diseases. The first term they present, and we've seen this before, is rhinorrhea, rhinorrhea. And from its word parts, what does that mean? Well, I hope you remember that means a discharge from the nose. There's something running out of the nose, and that's just the medical term for a runny nose, rhinorrhea. And we have a term that is the medical term for a nosebleed, and this is epistaxis. epistaxis, the medical term for a nosebleed. And you may remember we also had another term that means bleeding from the nose, the condition of bleeding from a nose. Do you remember that one? Well, that's rhinorrhagia, rhinorrhagia. That means bleeding from the nose. If you have the condition of a nosebleed, they might use epistaxis. Okay, and the next term is the medical term for an allergy, and that is allergic rhinitis. allergic, rhinitis, rhinitis. And that makes sense if you look at the word parts. Allergic means it's pertaining to an allergy, it's caused by an allergy. And rhinitis would be, based on its word parts, inflammation of the nose. The next term is upper respiratory infection, which is kind of a broad term. And the more specific and better term is acute nasopharyngitis. Acute, acute, then nasopharyngitis, nasopharyng, okay, and then finally itis, itis. And if you look at the word parts, it would mean inflammation of the nasopharynx. And do you remember what the nasopharynx is? Well, I hope you remember that the nasopharynx is the upper part of the throat that begins in the nasal passages and goes down just into the back of the throat behind the mouth. Okay, so that's that area where you get a common cold. That is what acute nasopharyngitis is. It is the medical term for the common cold. The next term is one that's been in the news quite a bit this fall, and that is influenza. influenza. It is often abbreviated flu, FLU. This is an acute, highly contagious viral respiratory infection that is spread by respiratory droplets, and it occurs most often in colder months. The flu is highly contagious. It is viral, meaning it's caused by a virus, and it is spread most often in the colder months. Those are the key ideas. That leads us to the next term, which is pertussis, pertussis, and that is also referred to commonly as whooping cough. And this is a disease that has been controlled by vaccine. It's a component of the DPT vaccine, but it has been making a slight comeback because of some kids that haven't been getting vaccinated. Now, the important thing about this one is it's contagious. It is caused by a bacteria. It is bacterial. That's different than the flu, which is viral. Okay? It's very important always to keep track of, is it caused by a virus or is it caused by a bacteria, because that's a way of distinguishing diseases. So while the flu is viral, pertussis is very contagious, bacterial. And it is characterized by recurrent bouts of paroxysmal coughing, really extreme coughing that causes you to spasm and shake. It takes over your whole body. And it's called whooping cough because if you have this, the coughing sounds kind of like the whoop, whoop of a bird. Okay? So again, pertussis, whooping cough, contagious bacterial infection characterized by the paroxysmal coughing. Okay, and that leads us to diphtheria, and this is a little tricky to spell. It's DIPH, there's this silent H in there, and then THERIA, diphtheria. This is an acute bacterial infection of the throat and upper respiratory tract. And in this case, what characterizes it is that the bacteria can produce toxins that can actually damage the heart and peripheral nerves. Okay, that covers the basics of the upper respiratory diseases. I've hit the ones that, again, are most confusing. And again, I pointed out it's important to keep track whether it's viral or bacterial, and also what is the defining characteristic of the disease in terms of what does it do to you. Okay, if you focus on that, you'll get these, you won't miss them on a test. So now we're going to go ahead and do some practice, okay? What is the medical term for the common cold? That is acute nasopharyngitis. ACUTNASOPHARYNGITIS. Acute nasopharyngitis. An acute bacterial infection of the throat and respiratory tract that can lead to heart and peripheral nerve damage is known as what? Well, that's diphtheria. DIPHTHERIA. And what is the general term for chronic disorders involving difficulty breathing that are associated with smoking? Well, that's COPD, chronic obstructive pulmonary disorder. CHRONIC, and then disorder, DISORDER. And what is the medical term for a nosebleed? That's epistaxis. EPISTAXIS. And what is the medical term for a runny nose? That's rhinorrhea. RHINORRHEA. And what is the term for a highly contagious viral infection that is most common during the colder months? That's influenza. INFLUENZA. And what is the term for the progressive loss of lung function that's characterized by the decreased number of alveoli and an increase in the size of those that are remaining? Well, that's emphysema. EMPHYSEMA. And what is the term for an allergic disorder that causes difficulty in breathing? Okay, the key idea here is it's allergic, and that would have to be asthma. ASTHMA. And what is the term for the ongoing inflammation and thickening of the bronchi and an increase in mucus production that causes difficulty breathing? Okay, this disorder is ongoing, so that ought to tell you it's chronic. And we have inflammation of the bronchi, that's bronchitis. So this is chronic bronchitis. CHRONIC BRONCHITIS. And finally, what is the term for a bacterial infection of the upper respiratory tract that causes bouts of paroxysmal coughing? That's pertussis. Pertussis. Okay, that covers the upper respiratory diseases. Now we have some terms to go over related to the lower respiratory tract, specifically the pleura and the lungs. Okay, the first term is pleurisy, Pleurisy. Another word that we can use in its place is pleuritis, Pleuritis. So pleurisy and pleuritis both mean the same thing. And based on the word parts of pleuritis, what does that mean? Well, that would be the inflammation of the pleura, and it causes pain with each breath because of inflammation. That's the key thing. And also remember that pleurisy or pleuritis could be used. Now, the next term is pleurodynia, Pleurodynia. And what would that term mean based on its suffix? Well, that's pain in the pleura during breathing. So if we go back a second, if you have pleuritis or pleurisy, you are likely to also have pleurodynia. Okay, pleuritis is the inflammation that causes pain as you're breathing, and the pain in the pleura as you're breathing is pleurodynia. And note that this term favors dynia. Okay, hyphen dynia. You wouldn't want to use pleuralgia. I mean, yes, that could mean and does mean pain in the pleura, but this term favors dynia, okay, pleurodynia. Okay, the next term is one of these words that uses the suffix thorax in it. And I mentioned this when we talked about word parts, that thorax, the suffix, often used in pathologies. So we have a term, pneumothorax, pneumothorax, pneumothorax. This is the condition of air in the pleural space that prevents the lung from fully expanding. Okay? Remember, relates to lung, it also relates to air. Okay? Pneumo can mean air as well as lungs. So, pneumo is telling us there's air, thorax is telling us it's in the chest or in the pleural space in this case. So, air in the chest, it really means air in the pleural space. And the air in the pleural space keeps the lung from fully expanding. So, it would make it difficult to breathe. Now, using that term as a pattern, again, it's a new way of forming terms for us. Using that as a pattern, I want you to think about what the terms would be for the next two items I've got for you. Okay, using this as a model, what would be the term for the condition of blood in the pleural cavity? Well, that would be hemothorax, Hemothorax. I hope you see the pattern there. Thorax, the suffix, is being used to refer to in the chest or pleural cavity, more specifically. The word part, which is a combining form technically, in front of the suffix is telling us what is wrong. That is, what is in there that should not be. Okay? In the first one, pneumothorax, air is in the pleural space. Hemothorax, blood is in the pleural space. Okay? So let's follow the pattern now for the third one. What is the term for pus in the pleural space or pleural cavity? Okay, I hope you remembered the word part for pus. That's pyo. So this is pyothorax. Pyothorax. So those are some things you're going to have to remember. These disorders related to the pleural space or cavity, they are formed in an unusual way. Okay, we're not using the word pleuro in them at all. Okay, we're using that suffix thorax, and a combining form in front of it tells us what is wrong. That is, what is there that should not be. Now I've got one more for you that relates to something wrong with the pleural cavity, and guess what? It doesn't follow the pattern, okay? This is the term for the abnormal accumulation of fluid in the pleural cavity. You'd think it would end in thorax, right? And that there would be some combining form meaning fluid or water. Well, we don't have one. So this term goes a little differently. The term for fluid in the pleural cavity is pleural, which would mean pertaining to the pleura. Effusion. Effusion refers to the flow of fluid from one place in the body to another. Pleural effusion. Pleural. Effusion. Effusion. So that is the abnormal accumulation of fluid in the pleural cavity. Term does not follow the pattern of air in the cavity, blood in the cavity, or pus in the cavity. Okay, now we can look at disorders related to the lungs. And again, I'm focusing on the ones that seem to really cause trouble for people. The first one is a very common term. It's pneumonia. Pneumonia. Where people have trouble with this is pneumonia is often associated with having fluid in the lungs. That is a byproduct of the disease. Okay? A lot of times people on tests will say pneumonia is fluid in the lungs. Well, no, that's not it. That's not the defining characteristic. That may be a byproduct, but it's not the defining characteristic. The defining characteristic is we have an infection, and along with infection, we would have some inflammation usually of the lungs in which the bronchioles and the alveoli fill with pus. Okay, that's the defining characteristic of pneumonia. We've got pus infection going on in the bronchioles and the alveoli. So you need to remember that. Don't fall back on kind of what is the common perception of, oh, well, you've got fluid in your lungs. That could be a byproduct of pneumonia. You could aspirate fluid, which then could lead to pneumonia. But having the fluid in the lungs itself is not the same thing as pneumonia. So be very careful of that. The next term is an unusual one. It's got a word part in it that we haven't seen before, and that is atelectasis. Atelectasis. And atelectasis refers to the collapse of all or part of a lung that's caused by a blockage that prevents the lung from filling completely. And so what happens is if there's not enough air getting into the lung, the air pressure in the lung is not strong enough to balance the external pressure. And so the lung will then collapse because of the pressure outside it, because the internal pressure is not enough, because not enough air is getting in there. So atelectasis, collapse of a lung caused by a blockage that prevents it from filling completely. And next we have two terms that have the word fibrosis in it. fibrosis. And do you remember what fibrosis means? Well, literally, fibrosis means the abnormal condition of fiber, but it's usually used to refer to a formation of scar tissue. So the first term we have is interstitial fibrosis. interstitial, and then fibrosis, fibrosis. Now, literally, interstitial means pertaining to in between tissues. In this case, the tissues we're concerned with, though, are the walls of the alveoli. Again, those sacs where the air exchange takes place. So, interstitial fibrosis is specifically the thickening of the walls of the alveoli. And there's usually inflammation going on with this too. So, we would say it's the inflammation and thickening of the walls of the alveoli. The next term is pulmonary fibrosis, Pulmonary, fibrosis, fibrosis. And that one's easier to get from the word parts. It's the formation of scar tissue, that's your fibrosis, in the lung, that's pulmonary. Remember, pulmonary means relating to the lungs. So pulmonary fibrosis, scar tissue in the lung, interstitial fibrosis, inflammation and thickening of the walls of the alveoli. And the final fibrosis term we have is cystic fibrosis, cystic fibrosis. And this is a term you've probably heard of. It does get some publicity. This is a genetic disorder in which the lungs and pancreas are clogged with abnormally thick mucus. Can't really get it from the word parts. You just have to memorize what it is. Cystic fibrosis, genetic disorder, lungs and pancreas clogged with mucus. Okay, so let's go ahead and do some practice over these pathologies related to the pleura and the lungs. Number 1, what is the term for the infection or inflammation of the lungs in which the bronchioles and alveoli fill with pus? Okay, you got to think about that one because it reads like a complicated definition for what is really a simple common term. This is our pneumonia, okay? Pneumonia. Number 2, what is the term for inflammation of the pleura? Well, the textbook gives us pleurisy, which is kind of an old-fashioned term, I believe. We could also say pleuritis. Okay, pleurisy is Pleurrisy, and pleuritis is Pleuritis. And what is the term for blood in the pleural space? Okay, this is one of those pleural space terms. Remember, we need the suffix thorax. It's blood, so this would be hemothorax. Hemothorax. And what is the term for fluid in the pleural space? Okay, this is that one exception to the pattern, right? This one is pleural effusion. Pleural, effusion, Efffusion. And what is the term for pain during breathing movements? Well, that's pleurodynia. Pleurodynia. And what is the term for a genetic disorder in which the lungs are clogged with abnormally thick mucus? That's cystic fibrosis. Cystic fibrosis. What is the term for air in the pleural space that prevents a lung from fully expanding? That's pneumothorax. Pneumothorax. And what is the term for the condition in which a lung collapses because of an obstruction prevents it from filling completely with air? Okay, that's a weird one. We can't really get it from the word parts. It's atelectasis. Atelectasis. What is the term for a disorder characterized by the inflammation and abnormal thickening of the alveoli? Okay, we've got abnormal thickening. That's like the scar tissue, like the fibrosis. And this would be interstitial fibrosis. interstitial fibrosis. fibrosis. And what is the term for the condition of pus in the pleural cavity? That's pyothorax. Pyothorax. Okay, well, that covers 2/3 of the pathologies. We've got the upper respiratory and the lower respiratory. Next time, we'll do breathing pathologies. And that's going to end this episode of the Medical Terminology Podcast.